Well, let's continue the conversation now with the Canadian Dental Association. Joining us now is Dr. Heather Carr, the CDA president. Hello, Dr. Carr.
Hi, I'm happy to join you this afternoon.
Well, really great to have you on because I do want to get some reaction here to this program. What are you hearing from your members? Are they happy with this development, perhaps concerned?
I think that I represent the national voice of dentistry, and the CDA has been advocating for care for these populations for many, many years. So anything that's going to help persons with disabilities, our seniors over 65, and the low-income individuals get care is a positive. The members are more the purview of the provincial dental associations and territorial dental associations, but I can tell you that my colleagues are I guess cautiously optimistic. There's still a lot of details that need to be rolled out. And I think that once we have all the details, that's when we'll hear a better sense of what the dentists feel.
So more details, which I don't think you're alone in that. But what specifically are you looking for here? What questions still need answers for you?
Well, I think that the Canadian Dental Association did a policy paper back in February 2023, and we asked for certain criteria to be met in this plan. So we want it to be patient-centered, a holistic plan, allow individuals to stay with their own dentist of choice, be carried out through existing offices, which it does appear that you'll be able to go to a dental office. But it also has to be prevention-based, because we all know in dentistry you want to catch things early, and you want to prevent disease rather than wait until someone's in pain. And the other concern that the Dental Association has proposed, the Canadian Dental Association, and I would say this would be supported by the provincial and territorial dental associations, is that you want something that's got a reasonable amount of administration. It's if there's just too much red tape, too much administration, that is going to impact the uptake, and of course to cover the full cost of the treatment for the patients.
Cover the full cost, as you say. In terms of the number of dentists who might step forward to be a part of this program, do you think that'll be a challenge at all?
Once we know exactly what they're stepping forward for, then I think you're going to have a better sense. I've been a general dentist practicing for 35 years, and my patients include a lot of the individuals who could be helped by this plan. And we're professionals, and we're caring, and we do step up for patients, but we just need to get enough information to be able to make that final decision.
Well, it looks like right now it will be going through an insurance provider. Does that, which seems to lean on what many are used to right now with going to the dentist, does that give you some comfort?
I think it's certainly what we're used to, dealing with insurance companies. However, it's going to depend on the conditions that the federal government places on the program, because ultimately, the Canadian Dental Association has been at the table providing advice and recommendation, and our provincial and territorial associations providing some technical briefings, but ultimately it is the federal government's plan. And hopefully over the next few months, and having discussions with the dentists, with the provincial and territorial associations, we can iron out some of the details to make sure that the patients who need care receive it.
And to that, I was actually looking at your recommendations a little bit earlier today. There seems to be an emphasis, among other things, on training to make sure that there are enough dentists and oral care healthcare workers in the system. Is there a danger of overwhelming the system? Is that what you're getting at here?
I don't know about overwhelming the system, but what we're finding is that, like most areas of the health sector, we are short-staffed. There's a shortage of skilled labor. So we certainly have been talking to the government about ways to improve its dental hygienists and assistants, and even front desk. So I don't know about overwhelm, but we certainly, if something came out that was very administration heavy, it's going to tax our front desk staff, for example, who are already working at their maximum potential.
Now, you also talk about, in your recommendations, making sure that public dental care programs remain a payer of last resort. What's your concern there?
Well, we have two concerns, I guess. We're afraid of displacement of insurance. So if the first one, I guess I would say, would be employer-sponsored plans. In Canada, we do have a third of the Canadians that don't have that access to care, which is why the dental associations have been so keen to see this program come in and work. But having said that, we do have 65%, or two-thirds of Canadians, who have had excellent care. And the reason they've had excellent care is because they had access to employer-sponsored plans, or they're able to fund themselves. And the other concern would be, and so if the provincial plans, I know the federal government is still negotiating with them, because in some cases the provinces have very lean plans, in other cases they're excellent. But our concern would be if, for example, if employers who are facing a lot of economic challenges decide that, well, my employees don't need dental benefits anymore. There's two concerns, really. I guess one is that maybe the federal plan is not going to be as good as what they receive from their employer. And secondly, if those individuals are displaced onto the federal program, will it be sustainable? They could go from, say, 9 million Canadians to 17 million. So the bill would be a lot higher for them if they're not looking at ways to prevent that from happening.
Mm-hmm. So as you said right off top, a number of questions that still need answers, a number of concerns as we watch this progress. So, the plan here is to enroll people gradually, as you know, and the bulk of eligible Canadians should be enrolled by the start of 2025. So I'm kind of wondering from perhaps as the CDA role, but also you as a frontline worker, how will you know this program is a success or a failure?
Well, I think it's going to be a success or failure if the patients get the care they need. So in other words, if we can get the patients in, and if the dentists enroll as providers for the plan, that if the government has provided this plan and we get those discussions done and the details ironed out, then we'll have success. If we get a good uptake by the dentists and by the patients, I think then the government this is a monumental investment. I mean, it's something that we never imagined would happen in my career, but it has to be done right. And the federal government has an obligation to deal with both the patient end of it and the dentists to make sure that it's a fair program for everyone.
Dr. Heather Carr, really appreciate the time this evening. Thank you for that.
I'm happy to. And if there's any other questions, please feel free to reach out.